Hello, I'm Dr. Yu. Today I'm here to discuss about development of personality. This is actually a continuation of our previous discussion on the development of personality as we discussed the psychoanalytical and new Freudian concept of personality development. We saw that they are more focused on unconscious perspective, unconscious tribe, and the development of personality and they emphasize less on the human potential and the development of personality. So today we will discuss the concept of personality development, which are more human based. They believe more role of human potential and the development of personality. In this regard, the important theories are the humanistic perspective of personality development. They believe the role of human potential or the concept of self-worth and the development of personality. According to the humanistic perspective, the self-actualization is the driving force for the development of personality. According to the humanistic perspective, there are different explanations of self-actualization. As we see, there are two very important names and this humanistic school of psychology, the Carl Roger and the Abraham Maslow. The Carl Roger stated that the self-actualization is earliest and highest level of one's completeness. That is the highest self. While the Abraham Maslow believed that the self-actualization is the highest level of human need. So, according to the humanistic perspective, if a person develops self-actualization, then he becomes potentially very active, he becomes very creative, he can utilize his whole potential for us and the benefits of others. To understand the concept of self-actualization, according to the Rogerian school of psychology, Roger believed that there are three versions of oneself. The self-image is what we believe about ourselves, and the ideal self is something what we would like to be. The self-worth is the capacity, the strength of someone to balance between the ideal self and self-image. Because this is very important. There must be a congruency, there must be a similarity between the ideal self and self-image to develop self to develop the self-actualization, which is actually the best version of someone. Here we can see that if the self-image and ideal self are similar, the person can develop self-actualization or best version of someone. While if there's any difference between the self-image and ideal self, then this lead to certain disturbance and certain problems. On the basis of self-actualization, Roger proposed some psychotherapy, which is called client-centered psychotherapy. According to the Roger, if we provide the self-actualizing environment to someone, to some patient or some client, then they can develop best version of their self, and that is very helpful for healing. So, according to Roger, by unconditional positive regard and non-judgmental total acceptance of the client, where he can express his feeling, where he can recognize his feeling, actually lead to healing. That is the basic concept of client-centered psychotherapy. The other name and the humanistic perspective is Abraham Maslow, who gave the concept of needs. The Maslow divide the needs of human into basic needs, which include the food, water, the safety, security, which is related to shelter, the psychological need, which is related to belongingness, love, self-esteem, and the self-actualization, which where a person can achieve the best version of oneself. Uh, by utilizing the Maslow's concept in our hospital, we can actually help our patient in a best way. According to the Maslow, if we provide adequate nutritional support to our patient, adequate safety and security, which is actually the basic need of the human being. Thereafter, we provide the patient with caregiver or allow them to meet with the visitor, which provide them with the love and belonging that need. And while calling the name of patient, while asking for the consent and taking care of the issue of confidentiality, the patient develops something what we call the need of the esteem. And with adequate treatment, we can make the patient to develop his full potential and to go back to community to work with his best potential. So these are some of the humanistic perspective and the development of personality. I hope these were useful. If there's any question, kindly feel free to write in the chat box. Thank you.